St. Vincent de Paul Pharmacy.
Ethel Combs is more than a volunteer who answers the phone and greets patients at the St. Vincent de Paul Community Pharmacy in Baton Rouge.
I was diagnosed with adenoid polymorphous cancer of the right palate. And I had my surgery like in 2005 and went through my chemo and my treatments. And then I came here to get medicine because in all the process of having the cancer treatments and all of that, even though I had insurance at the time, I just depleted all of my savings. And so I came here to get my medicines.
Ethel says she couldn't afford the very medicine she needed to stay alive. She understands what it's like to feel embarrassed to ask for help, and it's why she gives of her time as a volunteer.
I'm the first person that the people see when they come in the door. So I try to make it as pleasant as possible because I've been there.
Hello, how y'all doing?
Jamal Hunter relies upon the generosity of the Society of St. Vincent de Paul.
What I was making at $7.90 an hour, it couldn't pay for all the prescriptions that I needed.
Prescriptions Jamal could not live without.
They're there for me in all kinds of ways. They do save my life. They have saved my life.
Vincent and Anna George and her husband Lawrence believe the community pharmacy does vital work to preserve the health and dignity of those in need. Vincentians do not judge those who they serve. Rather, they seek to understand them as they would a brother or sister.
And I see the people. I know a lot of them are really working hard and doing everything right, but they still can't quite make it. And it's really good to know that you can make a difference in someone's life.
You see a lot of these people that come in and they're really down on their luck, and they really need the assistance. And you think that you're really doing something good. You're contributing something, I guess, to society.
While Anna had worked in the pharmacy field for 16 years, Vincentian Phil Bruder was a novice when he came to this pharmacy right after it opened in 1995.
My experience has nothing to do with pharmacy. My experience is in construction and maintenance.
Phil was inspired to become a licensed pharmacy tech so he could better live his Vincentian vocation to help his brothers and sisters. Phil's family was helped by the society when he was a child, and he has never forgotten the help he received. He picks up donated medicine from nursing homes, sorts through the meds, and disposes expired pills.
Most of them are desperate. They're on their lifeline where they can get medicines. If they can't get it here, there's nowhere else for them to go.
More than 30,000 prescriptions worth approximately $3.2 million are dispensed here at the St. Vincent de Paul Community Pharmacy. But none of that would be accomplished without the generous donation of time from volunteer pharmacists. Volunteer Chris Godet, a pharmacist for 40 years before retirement, follows his faith as a Catholic as he gives back to help his neighbors.
Anything that you would see in a typical drugstore, like a CVS or Walgreens, you see the same kind of ailments and disabilities come into this pharmacy, whether it's mental health, blood pressure, HIV, psychiatric diseases, diabetes. It's a wide range of illnesses that we actually are able to treat.
And it costs people what?
Nothing. There's no charge at all.
You get treated the same. You get treated the same.
But I'm gonna wait for Mr. Dunn because I'm picking up my husband. So. Okay. Thank y'all. God bless y'all.
Staff pharmacist Charles Side says the prescriptions come from donations from nursing homes and pharmacies that donate bulk medication to support the Society's mission of mercy to help the forgotten, the suffering, and the deprived.
Like I just gave that lady some medication that was probably about $4,000 for her, I think it was her husband. It was just come out of the hospital. It's a blood thinner he has to use for like he got 20, 30 days.
And Charles knows his work is life-saving.
It's a good feeling, it really is. Because you see some people that they couldn't make it. They didn't have if St. Vincent Paul wasn't here to help us.
If this particular pharmacy wasn't part of the community, those individuals wouldn't be served at all. And you would have people who are diabetics, people who are asthmatics, who wouldn't be treated. Their disease states would get more debilitated to the point where they would either die or they would have to go into the hospital emergency room.
The Vincentian calling to bring Christ's love and to serve others gives the Georges so much joy.
I get so much more out of it too. I mean, I really get a lot out of it myself. They give me, you know, I see myself, I could be in that condition. And if I were, I would hope someone would help me. So I know how blessed I am. And I really want to give back because God's been good to me, to both of us.
We look upon it kind of, you know, as an opportunity to help those in need. Those aren't as fortunate as we are.
Ethel relates to the patients and encourages them to reach out to the Society of St. Vincent de Paul. She knows the caring and compassionate Vincentians and Catholic volunteers are eager to help their neighbors in need.
Don't be embarrassed, don't be nervous. These people are here to help you and they enjoy it. It's a pleasure for them to help you.
The person-to-person service that the Society is known for makes a profound impact on people. Jamal is grateful the Society treats her with love and respect.
They feel more love for another person than just themselves. I thank God for them, for being there. They're just like family.
A family of Vincentians and volunteers living gospel values by helping the working poor, the homeless, and those who cannot afford life-saving medication in Baton Rouge. For our Faith in Action, today's Society of St. Vincent de Paul, I'm Paul Boron.